Hi everyone, this is Dr. Labraj Sundar here at Joe Colonial Clinic in Brampton, Ontario. So today's topic will be on golfer's elbow. The medical term is medial epicondylitis. Similar to last week's segment, I talked about the pain on the outside of the elbow. This is pain on the inside of the elbow. So it's pretty similar, but the treatment's a little bit different. So basically, golfer's elbow doesn't just affect golfers. It can affect anyone who does repetitive wrist movements or elbow movements. It could be due to sports or work-related tasks. And the most common signs and symptoms include pain and tenderness in here. So if you touch around here, it hurts. You get weakness in the wrists. It's hard lifting objects. It really hurts along this whole area. You can also get weakness and numbness or tingling type of feeling in the ring finger or the pinky finger. That's usually due to pain in this area. And then you can get pain with shaking hands, turning doorknobs, lifting anything heavy with the wrist, and just the shooting pain down the forearm. So those are usually the common, and when playing golf, of course, because the impact of if you're not doing it properly, that's quite common. If you're not using proper form, you can get a lot of impact going on in this area. So that's why they call it golfer's elbow. So the main diagnosis for it, you don't really require any imaging. Most of it is concluded with just the explanation of what's going on and the physical examination. So if it is something that you were diagnosed with, it is easy to treat. It does depend, it does take certain amounts of, it depends weeks or months, it depends on the severity of how bad it is. For the most part, physical therapy will help. Chiropractic, of course, can help with stretching and strengthening the muscles. Homeopathy is a great option as well, because the medicine will help to repair the internal damaged tissue in the area. So a combination of both of these things will help overall with the treatment. And if it's diagnosed and it's acute, so say within 1 or 2 weeks, the first line is to put ice on it for 15 to 20 minutes, 3 times a day, and then self-massage, and then do chiropractic and homeopathy. So those are the treatment options for golfer's elbow. So now I'll go over through the 3 different exercises that are for this condition, and it's quite common to the lateral as well, because you are doing a lot of wrist stretching and strengthening. So the first one is going to be wrist stretching. So you're just going to have your arm out, and then again, same thing. I've done this so many times, but this is one of the main treatments or self-stretching at home. So again, you're just going to really try to push the fingers back, and you'll feel the stretch all along the arm here. And then you can also do this way as well. It doesn't hurt to do this one as well. And then that's just for the stretching part. The strengthening part, again, I'm just holding anything that has a little bit of weight, and as you progress, you can add more and more. But first, just have something about 5 pounds, I would say, is good. And you're gonna do more like this, so the wrist flexion. So you wanna do about, say, 10 to 15, 2 times a day. And then if you can handle that, then you can just increase the repetition. So you wanna keep your elbow straight, and you wanna just, flex the wrist like this. What this does, it helps to actually target that area that's connected here. So you wanna work on strengthening the muscles in that area. The last one is elbow just flexion extension. So again, like you're doing a bicep curl, same thing, it targets the same area. So you want to just have your elbow close to your body and then do these. And then you don't flex the wrist, you just kind of keep it straight, but I'm moving from the elbow, that's it. And again, you can increase the weight depending on how fast you're healing, and always consult with the doctor who's treating you so they can help you with the exercises. The last thing is the acupressure points. So the first one at home, again, is right here. You can hold for about 15 seconds. So right at the part of the bone here on the inside. So just hold it there with your finger. And then you should feel, it might hurt a little bit, but it will help. And that's a tender point, acupressure point for this condition. Okay, and the other one is again the same one. This one helps for all these conditions of the elbow in between the thumb and the index finger. And same thing, you can hold for about 15 seconds and do it 2 or 3 times a day. And that's it. So then that concludes today's segment, and I'll join you guys back next week. Thanks.